Good morning, it's Abby from ALC Courses. In the light of the current coronavirus crisis, I've decided over the next few days to give you all some first aid advice of how you could help people. Today we're going to focus on adult resuscitation. I'm starting with this because of the heightened awareness of the possibility your victim may have COVID-19, the Resuscitation Council UK have offered some different advice. We can still check our environment and check for danger as we would at the beginning of our normal initial assessment or primary survey. We can still check for levels of consciousness by calling the casualty and speaking to them to see if they respond. We can also still tap them to see if there's any sign of consciousness. Recognising cardiac arrest by looking for the absence of signs of life and the absence of normal breathing are the changes here. We're not going to listen or feel for breathing by placing our ear or cheek close to the patient's mouth. If you're in any doubt about confirming cardiac arrest, the default position is to start chest compressions until help arrives. Make sure your ambulance is on the way. If COVID-19 is suspected, tell them when you call 999. If there was a perceived risk of infection, rescuers should place a cloth or towel over the victim's mouth and nose and attempt compressions-only CPR and early defibrillation until the ambulance or advanced care team arrives. Place your heel of your hand in the centre of the casualty's chest. Lock your fingers over. Keep your arms straight and compress hard and fast to a depth of about 5 to 6 centimetres or a third of the chest. Keep this up until help arrives. Early use of a defibrillator significantly increases the person's chance of survival, but does not increase your risk of infection. If you have access to a public access defibrillator, don't hesitate to use it. We'll be going through public access defibrillators later on in the week. If the rescuer has access to personal protective equipment like a face mask for yourself, gloves or eye protection, these should also be worn. After performing compressions-only CPR and handing over to the ambulance service, all rescuers should wash their hands thoroughly with soap and water, alcohol-based hand gel, and then they should phone the NHS 111 Corona advice line and tell them that they may have been exposed to COVID-19.